I woke up lying on the floor. I could feel the cool tile on the backs of my arms. But I was just in bed. How did this happen? The nurses were crowding over me. Then came the doctor, asking me dumb questions, like how many fingers she was holding up, and what my mom's name is. Barb, of course. Where is she? Why am I not in bed? I'm so confused. I had my first seizure when I was 18. I guess it shouldn't have come as such a surprise. I had been sick. My body was weak. Beyond weak, it was crippled. That was my 40th day in the hospital. I had spent those 40 days fighting a terrible and cruel digestive disease, ulcerative colitis. Technically, I had been dealing with it since I was 16, but this was the first time I had to fight it. My body was deteriorating before mine and my doctor's eyes. I was 109 pounds, down 25 from the month before. My muscles were shrinking while my stomach swelled with a rotting colon inside. I couldn't eat. Poisonous medicines were being pumped into my veins in a last-ditch effort to save my colon. They didn't work, and surgeries began. I was depressed in the hospital, stuck in a hopeless situation. I did what little I could to hold on to my faith and to believe that everything would work out, but deep inside, I was certain I would die. It frustrated me to know that everything known to man was being tried and failing. But in the midst of all the craziness, I felt blessed. Blessed to even have the opportunity to live. I had the necessary medicine and skilled doctors at my fingertips. Yes, things were going downhill, but I was given a fighting chance. I started to wonder why others don't have that chance. Why are these vital resources kept from certain people? This is a shot at life that we're talking about, not some expendable item. I would be dead if I was in another country. Other people die from issues much simpler than mine. Why do I get to live? Although I wasn't quite sure why I had the privilege of living, I knew that if I was alive, I was going to make damn sure I didn't make a waste of my life. And as I returned to school a year later, after 5 more surgeries and a half dozen hospital stays, the questions I asked that day in the hospital continued to plague my mind. I wasn't certain how my insights fit in, but I knew I needed to be a part of the medical world. Inspired by my own doctors and the impact they had on my life, I started on the pre-med path. Hard science alone just wasn't satisfying my needs, though. I knew there was more to life, more to the people I would be treating and the world I was living in than molecules, equations, and reactions. There are reasons people are sick beyond the bacteria and mutations. I wanted to understand the social structures that create and exacerbate illness, to be in touch with the patient and his or her surroundings, to understand how class, gender, and race determine health, and most importantly, to advocate for patients and the right every individual has to healthcare. I became involved with the Crohn's and Colitis Foundation of America, advocating for patients' rights, becoming a mentor to other patients, and helping to build awareness around digestive diseases. I've created programs to help educate and empower young people who are chronically ill. Pediatric patients have a special place in my heart, and along with educating their parents on how to manage their child's illness, I also make blankets for the kids and rallied with family and friends to get an entertainment center placed in my local children's hospital. I traveled to D.C. to speak to legislators about healthcare funding and rights for the sick. I've raised over $25,000 to fund research and recently had the opportunity to work with a researcher at an urban health clinic. I began work on my honors thesis, examining social determinants of health and barriers that exist to accessing healthcare for underserved populations. And I spent a summer working at Centro Salud, a clinic dedicated to serving uninsured and underinsured Hispanics. And since I can't solve the problem of illness in the world right now, I focus on bettering the experiences of patients by ensuring they are educated, empowered, and knowledgeable about their rights as chronically ill Americans. My experiences with illness have shaped who I am today and what I find important. And while I'm not sure what path my life will take next, I'm happy to say that healthcare will always be a part of it.